Okay, so this is part 2, and the first paper we called Solving the Gordian Knot of Conflict in the Family and Domestic Violence Courts. This one talks more to the research gap that's underlying this crisis that's happening in the family and domestic violence courts. So just an overview, we covered many things in the first paper. Won't go over this again. I don't think we need to go over that again. Okay, so starting with the personality disorder pathology. A personality disorder is just a persistent and pervasive maladaptive behavioral, emotional, and cognitive pattern that differs significantly from societal norms and expectations, which causes prominent problems in one's daily life. That's just the definition of a personality disorder. There are 3 clusters. There's 10 personality disorders altogether. With this particular family court issue, what we're concerned with comes from cluster B, and it's specifically from the borderline narcissistic and antisocial personality disorders. And incidentally, about 10% of all adults have diagnosable personality disorders, whether they have been diagnosed or not. From the borderline and narcissistic personalities, what's really important to know is that both of these are prone to experiencing anxiety and depression, and they are both prone to intermittent and or persistent delusions, especially delusions of persecution. Which is sometimes referred to as sociopathy or psychopathy. What's important to know about that is that there is a 2-factor model for psychopathy that draws from the traits from antisocial personality criteria. Factor 1 talks more about the interpersonal and affective or emotional elements of antisocial personality, whereas factor 2 talks more about the deviant social elements and behaviors. So one is more relationship and emotion based, and the second one is more behavior based. So factor 1 and factor 2 psychopathy. Also, Machiavellianism is an immoral, cynical, strategic manipulation to meet one's personal goals and to gain power. And this comes from Machiavelli. These people who have this trait, they are prone to experience anxiety and depression. Sadism is the taking of pleasure in another's physical or emotional pain, and that includes their domination, their control, their punishment, their humiliation. So not just physical pain, but also these emotional elements. So the subclinical dark personalities, what this means is that these are people who do not meet all of the criteria for a full-blown personality disorder, such as borderline personality disorder or narcissistic personality disorder or antisocial personality disorder. But they do have many significant traits from a combination of those personalities. The dark triad is composed of grandiose narcissism, and so this is typically going to be the very overt and flashy narcissistic traits. It uses factor 1 psychopathy, which was the emotional elements of psychopathy, and Machiavellianism. The vulnerable dark triad, on the other hand, draws from vulnerable narcissism, and so these are narcissists that are not as overt and flashy. It also pulls from the factor 2 psychopathy elements, which is the behavioral problems of psychopathy, and from borderline personality traits, which borderline personalities are very highly reactive and very sensitive to rejection and abandonment. And the dark triad uses all 3 of the dark tetrad uses all 3 of the dark triad traits, and it brings in sadism as the 4th element. So again, borderline narcissistic personalities are prone to anxiety, depression, delusions of persecution when under stress. And the dark triad has been described as the core of evil. Trauma origin delusional disorders. So Again, a delusion is just a fixed and false belief that persists despite conflicting evidence. And they can be temporary experiences, or they can be very severe, firmly held beliefs. When categorizing a delusion, those are put into 4-dimensional classifications. So one would be whether or not the delusion is mood congruent or mood neutral. In other words, is the delusion based on the person's mood, or is it there regardless of the person's mood? Then there's bizarre versus non-bizarre. Bizarre would be believing in aliens, believing COVID-19 vaccine makes people magnetic, but a person could identify those. The non-bizarre becomes much more problematic because these can be totally plausible, totally believable. They could happen, and so anybody could believe that this is true and not a delusion. And some examples that come up in family and domestic violence court situations most often are that, like, a romantic partner has been unfaithful when they have not. That's a jealousy type delusion. And 2 examples of persecutory delusions would be that everyone is out to get this person, or that there's this unwarranted belief that the ex-partner is abusive when they're not. So an encapsulated non-bizarre delusion. An encapsulated delusion refers to a topic that's isolated, that doesn't pervade the individual's life or inhibit their ability to adequately participate in society. So they can hold down a job and they can look completely normal other than this one delusion. And typically only the people who are very familiar with the details would even know that it's a delusional belief. They're very problematic in family and domestic violence court cases because the content of the encapsulated delusion is theoretically plausible. And as I said, it can evade detection, and it doesn't impede the person's daily functioning in their other areas of life. And as I've said before, trauma origin delusions are believed to be much, much more common than previously realized. So we covered this screen. I think this one just kind of includes a little bit more of, if you are interested in learning more about delusions, induced delusional disorder. It goes by several different names throughout history. One of the most well-known is folio do. But you can see right here how folio do refers to a delusion between 2 people. But as more people are drawn into the delusion, it increases, to a definition for 3, 4, 5, all the way up to a complete family, and spread out from there. You can see this in many different, like religious cults would be examples of induced delusional disorders, things like that. So they're very common. So shared delusions are often described as being either simultaneous, communicated, imposed, or induced. Really, the most important thing to know about this is that simultaneous delusions occur when both of the people who are involved in the delusion have genetic or mental health risk factors for delusions. So, could be anything from schizophrenia, or maybe 2 people with personality disorders who come, get into a shared delusion together. The other 3 kinds are when the other person in the shared delusion is not predisposed to having delusions. And so very often when you are able to remove that person from the influence of the primary delusion case, the secondary person's delusion will go away, which is why Dr. Childress recommends, obviously, this protective separation and this reintegration through, for example, programs like the High Road with Dorsey and some other things like that, is that the delusion can disappear very, very quickly just by removing the influence of the primary case. So what is the purpose of an induced delusional disorder? The purpose is that the shared delusion serves to preserve the relational attachment. When the relationship between the 2 people, there has not been a healthy separation individuation process. It goes back to the enmeshment concept. And the enmeshment is, again, the dysfunctional form of relational cohesion, where individuals are overly involved, highly interdependent, and lacking in privacy or individual thoughts, beliefs, ideas, goals, or identities. So a parent-child relationship is very susceptible to this dynamic. Induced delusional disorder does most often occur in families, and that, just not even with divorce in the picture, even with, families that are intact. And when induced delusional disorder is diagnosed in a child, a parent was the inducer over 90% of identified cases. So this is all in the literature. We know about all of this. So although delusional disorder is the most common diagnosis in the primary or the inducer, they can suffer from other psychological disorders that haven't been previously linked to it, such as a personality disorder or having a dark personality pathology. It's known that induced delusional disorder is under-researched, so that makes the epidemiological data, which is just the rates of its prevalence, misleading and inaccurate. When it's identified, persecutory and grandiose delusions are the most often seen in the inducers, and parents with narcissistic or borderline traits strongly tend to impose delusions on their children when they're very stressed, and children strongly tend to adopt those delusions. So what we're recommending is that clinicians, when they're doing these clinical assessments for families, they should routinely investigate the patient's close family members. So the parents primarily of the child, to detect the possibility that the child is suffering from an induced delusional disorder so that it doesn't go undiagnosed, and so that they identify the proper primary or inducer. And obviously, we're recommending that more research should be conducted with families who are involved specifically in high conflict divorce. And those are my references. And then just the same ending page with the information. I'm doing this presentation many different times, so